some, he was the most trusted man in medicine, but to others, he was also the most polarizing. Dr. Anthony Fauci's tenure in public health is marked with major triumphs, but also controversy, especially as he was inadvertently thrust into the middle of the political debate swirling around COVID-19. He spoke to me about that and where we stand when it comes to our next health crisis. More than half a century at the National Institutes of Health, serving under 7 different administrations, earning the Presidential Medal of Freedom. Even though Dr. Anthony Fauci has ascended to what many would consider the peak of public health careers, he says his humble Brooklyn beginnings are really what shaped him to this day. I read somewhere a friend of yours had said that you had a lot of street smarts growing up in Brooklyn. I want to know how has that impacted your life? How has that helped you in what you do now?
It's very important. I mean, to have a gut instinct about what's going to happen, anticipating things. You learn that, on the mean streets of New York, but that was very important and still serves me very well.
In his more than 50 years of government service, Dr. Fauci has had his hand in treating a number of diseases that have altered life as we know it, like HIV/AIDS in the 1980s.
This is a very puzzling syndrome, and scientists like myself and others of my colleagues are taking different approaches.
The Ebola virus outbreak in 2014.
How we are going to address the potential of an outbreak.
But nothing would catapult him into the spotlight and hot seat like COVID-19.
The evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a balance.
COVID-19 became a household name, with Arizona seeing its first confirmed case in January of 2020. Nearly 3 years later, there are vaccines, life-saving treatments, and a better understanding of how this virus operates. Significant progress, but it doesn't mean that there aren't regrets. Regarding the COVID-19 pandemic, Dr. Fauci, is there anything you would have done differently looking back?
Well, of course. I mean, to say there's something that nothing you would have done differently means you were perfect. And nobody's perfect by any means, certainly not I. The science gives you information that's present and current at the time. And when that changes, you need to change. Some people call that flip-flopping. It's not flip-flopping. It's keeping up with the evidence.
Looking back, would you have recommended masking up sooner?
Oh, absolutely. Had we known that it was aerosol spread and that a lot of the transmission was from asymptomatic people, and there was asymptomatic spread going on under the radar screen, of course.
Dr. Fauci is perhaps the most recognizable face from the COVID era, a man equally as celebrated as he is criticized. What was that like for you to become the subject of so much anger and hostility as you were trying to help the country get out of this pandemic?
What I was able to do and still do is to compartmentalize and not pay any attention to that, but to focus like a laser on what my job is. And that's what I do. And that's what I've always done. All that other stuff is noise. I don't pay attention to that.
But there is something Dr. Fauci says he can't ignore and doesn't want us to either. It was the unexpected enemy of the COVID crisis, misinformation. As a public health official, though, how do you combat that?
Well, that is not an easy task, because the people who are spreading misinformation and disinformation seem to be doing it with an extraordinary amount of energy and purpose. We've got to keep our foot on the pedal and press it to the floor when it comes to continuing to disseminate evidence-based information.
Do you think the U.S. is prepared to face another pandemic?
The one thing we've done extremely well is the scientific preparation to proving that the vaccine was safe and highly effective, and to have it going into the arms of individuals in less than a year is beyond unprecedented. The thing that we haven't done so well with is the public health response. And I think that's the lesson that we need to learn.
Dr. Fauci says he's not retiring. Instead, he's planning to release a book and is hoping to work possibly in an academic setting. And more than anything, really wants to mentor young doctors and other health professionals. To see both parts of my interview with Dr. Fauci, just go to ABC15.com.
It is 5:30.